You have more conviction than I had. You have more knowledge than I had. So I'm looking forward to many more Secretaries General from the UTG, not just of the Republic of the Gambia, but of the United Nations and its allied institutions. This is possible and this must be done. There are no excuses for failure. You don't have any.
The celebration also witnessed mooting, debates, public lectures, and awards of certificates to both past and present outstanding students. It could be recalled that the law students took part in a mooting competition in South Africa, where they competed with students from 50 top universities and were ranked third, coupled with their respectable performance in academia and in the legal profession here in the Gambia. Buba Sise, Grts.
The Ministry of Health and Social Welfare and the World Health Organization Country Office have opened a 4-day forum on national health policy document development. The forum is aimed at developing the National Health Policy Strategic Document, which is to be finalized in January 2014. Umijai reports.
Numerous achievements since 1994 to date, which contributed to socio-economic development and wealth creation within the context of primary health care. It is for this reason that the Ministry of Health and Social Welfare, funded by the World Health Organization, brought together stakeholders to promote and protect the health population through equitable provision of quality health care. The health policy is in line with the Vision 2020 and the Millennium Development Goals, aimed at raising the standard of living by transforming the Gambia into a dynamic middle-income economy.
I would like to emphasize the importance of linking the national health policy to the development of the National Health Strategic Plan, as this will provide strategic direction for the ministry to measure progress and achievements. In addition, the output will be the basis of mobilizing resources for improved health service delivery.
The forum is expected to address key issues which will culminate in the development of a strategy plan and map out constraints and challenges in the health sector. The WHO country representative, Thomas Sukwa, assured the participants of his institution's support to the health sector, which is a priority concern in the Gambia.
This state of affairs has increased the urgency of putting in place national health policies, strategies, and plans that are comprehensive, coherent, and well-balanced, both in scope and depth, in order to address the challenges faced by the health sector.
Despite the gains made, experts observe that there is still room for improvement to accelerate the development of policies and strategies in the health sector.
The ministry, with the unflinching support from partners, continues to register remarkable improvements in the health and well-being of the population. Despite the gains made, notable gaps still exist that necessitated the development of policies and strategies to address the constraints and challenges of the health sector. Chairperson, distinguished ladies and gentlemen, it must be realized that in the absence of an operational framework, health service delivery efforts will be compromised. Over a decade now, the sector has been operating without a national health sector strategy plan that is linked to the national health policy. In the absence of this very important operational tool, it has been a challenge not only to measure progress and achievements, but also to adequately mobilize sufficient resources, efficiently and effectively coordinate and harmonize government and donor support.
With this venture, the health sector and relevant stakeholders are expected to tackle the challenges and at the same time develop a comprehensive strategic plan, which is expected to be finalized in January 2014 in the public health system. Umijai, Grts.
And to another health-related story, pneumonia is one of the leading causes of deaths in the world. Now, medical experts are pushing to find remedies to this disease with the search for affordable vaccines. The latest vaccine set for clinical trial in the Gambia is the Pneumo 13 multi-dose vial. Rohibite reports this latest partnership between the government of the Gambia and the Medical Research Council form part of efforts to effectively tackle the prevalence of pneumonia, meningitis, and ear infection.
Research Council of the Gambia, in its search for affordable vaccine for Africa, is on the verge of introducing a new vaccine recommended by the World Health Organization to the Gambia. The new vaccine, called pneumococcal multidose, is said to be very effective in the prevention of pneumonia, meningitis, and ear infection. Pneumococcal multidose is a highly expensive medicine which can be very costly to many developing nations. As a result, the MRC is introducing this current vaccine, which is provided by the Global Alliance for Vaccine Initiative, Gavi. This pneumococcal multidose new preparations put 4 doses into 1 vial and reduces storage costs, making the vaccine more affordable for African countries and a determining factor for sustainability. This new vaccine, whose clinical trial is to start in December, was revealed during the MRC partnership celebration with the government of the Gambia and stakeholders in improving the health and well-being of Gambian children. Vaccine trials are said to be key as new ones are discovered.
I think to describe genuine partnership, one would have to mention the partnership between the Medical Research Council unit and also the Gambia government. If you look at the health cards that I see floating around, the blue health cards, they are second to none in the African sub-region. This amply demonstrates that working together and through partnership can really achieve great things.
As childhood vaccine for preventable diseases remain a huge challenge to the world, MRC the Gambia is said to have been a key partner in supporting the government of the Gambia in the strive for attaining health for its people, especially children.
In collaboration with the MRC, lots of strides have been registered by the Minister of Health under the able leadership of His Excellency the President in the area of childhood preventable diseases. I wish to thank the MRC for organizing this event and also for the continued support to my ministry.
This research on pneumococcal multidose vial, which is to be introduced in December, is very timely, as this will drastically reduce the demand on cold chain space. Cold chain equipment is very expensive and has been an additional financial burden on the introduction of new vaccines. Vaccinations have the primary responsibility of preventing diseases, as indicated in the slogan, prevention is better than cure.
As part of the celebration, several doctors in the field of research gave feedback of their research programs and their impact on the country's health sector. Dr. Anna Ruka, Principal Investigator of the Multidose Vial, and Dr. Olu Bukola Idoka, Clinical Trial Coordinator of the Multidose Vial, explained the significance of the vaccine and how they plan to go about the trial.
It's the role of this study. These vaccines are available. These vaccines are in the Gambia, but now we have to ensure that these vaccines will be accessible, affordable, and long-term sustainable.
Talked a lot about the pneumo vaccine and why we need a new preparation of this vaccine. I'll say a little bit more about this. Cost is a major issue here. We have these vaccines available to us today through the support of Gavi, an alliance that helps to make these vaccines available to countries within our region. However, this support will not continue forever, and as a region we need to do something to ensure that we continue to have these vaccines sustained within our EPI programs. For this reason, we would like to test this new preparation of the Pneumo 13 vaccine, which instead of 1 dose of the Pneumo 13 vaccine in 1 bottle has 4 doses. And I'm sure it goes without saying that this will definitely drive down the cost of delivering this vaccine within this community.
If the trial of the pneumococcal multidose is effective as expected, it can immensely help in the prevention of pneumonia, meningitis, and ear infection in the country at an affordable cost. Rohibite, GRTS News.
From there, we'll take our first break. Stay tuned. Welcome back. Libya is demanding answers about the U.S. raid in Tripoli. Special forces captured Abu Anas al-Libi over the weekend. He is a suspected al-Qaeda senior member. Now Libya's government has summoned the U.S. ambassador to face questions, and new details